I was going to transition and pass it over to PA Brosnan to kind of speak on this very innovative way that she utilized her funds. She hosted an HIV symposium for her students and healthcare providers and community members, but I will go ahead and let her speak on it.
Yep, just sharing my experience with you all. And so sorry, I targeted some of this as if like maybe a program was here that hadn't started anything yet. So some of this maybe like I already know this information, so I apologize. But this was my timeline. I actually was hired in 2022 in my position, and right around when I was hired, I found out about the grant opportunity, and really took that time into 2023 to like stew on what I was going to do, especially with the funding. Also, I to just like introduce myself with the NHC is I used it to kind of teach the students. I used some of the curriculum and integrate it into my lectures with the students just to get myself familiar with it. So my whole point with this slide was just to give credit to the fact that ultimately what I did with the money was really influenced by students and their ideas. And so I was just going to encourage other programs, if you're kind of stumped of what to do, focus groups are a great idea. I couldn't have imagined the things that we ended up doing had I not talked with students first. And then, yeah, the lessons that I chose to complete, like this to me was the easy part of meeting these grant requirements. So I did 10 lessons across at least 2 modules. And this is just an example, like we use a platform called Canvas for the students and their assignments. So, and I was really influenced by the guide that the Take on HIV team made, which was very helpful because again, my heart with this was to increase their confidence in primary care with HIV. So that's how I chose some of the lessons. So this is their guidebook and what they recommend. I didn't use all of these. I kind of, like I didn't do hepatitis B co-infection. I chose like STIs or STDs. I did one antiretroviral, not both those. So can take and choose, but this guide is very helpful. And then just a screenshot of from the platform, how nice and user-friendly that was. And so while I had the students actually turn in their assignment or turn in their certificates of completion, it was nice also just to like quickly go to this platform every so often and check in with my learners on the side and then be able to see like who had completed them. Just nice visual representation. Okay, so now the big thing of what did I do with the $7,000? Because that's where I was kind of stuck. So the first I did with the money was I established an HIV rotation. We currently have lots of different opportunities for our students, and they have their clinical rotation year is 12 different rotations. So they have 4 of those can be electives, and we currently do not pay our preceptors to take students. One day we will, that's the direction things are headed, but for now we don't. So what I did was some of the money was I was able to use my own network contacts in HIV, as well as kind of at the county level. We have an HIV administrative agency here that helped put me in contact with some. And then I was able to to basically pay preceptors to take students. So they get $400 per student. What's great about, and these are the 2 sites or the 2 big organizations, and then it's 3 sites. So CAN Community Health, which does have other clinics throughout the United States, and same with the AIDS Healthcare Foundation. And the great thing about these clinics and the experience for the students is that these have been not just HIV care, but just they offer primary care and wraparound services like housing and transportation and food pantries and things that the students really get a nice holistic experience there to see somebody really being taken care of as a whole person. And so I have 7 students doing rotations this year with that. Okay, and then the second thing I did, so that didn't take care of all the money. So this other thing I did was I called it an HIV symposium. And I did use class time to do this. I could see I just scheduled it for a morning, and then it had 3 parts to it. So I had a lecture kind of style or like kind of like casual conversation about what's called the status neutral approach to ending the HIV epidemic. I had a panel discussion on stigma and HIV, and then the last part of it was student presentations. So I'll get into those. So My first was, you can see here in this picture, I brought in 2 speakers. So one was a PA and the other was a nurse practitioner to talk about this, like I said, status neutral approach, which is where if you have a person and they get tested for HIV, regardless of their test result, you do something for them, you offer them something. So maybe it's they're at increased risk of HIV, so it's a discussion on preventing HIV and PrEP. Or maybe they test positive, and so that's getting them treatment as quickly as possible and getting them plugged into care. So that was great. I paid each of these people to talk. And then the other really great thing was I was able to, so with our Tarrant County here in Fort Worth, the HIV Administrative Agency has a community advisory board. And so I was able to approach them and get 5 members of their community advisory board, plus a moderator, to come in and do a panel on stigma and HIV. And so this was really powerful for audience members. And I paid each of these panelists to come. Okay, and then the last part was student presentations. So this was where this came from, was I really wanted to make the curriculum more like meaty for students. I appreciate the curriculum, but I wanted it to just really come alive for the students. So what I did was I chose 5 areas from the curriculum that I felt like were really important in ending the epidemic. I mean, it's all important, but just try to pull out kind of 5 key areas. And so you can see them listed here. These are all like lessons within the curriculum, except stigma. Stigma was a little more challenging. I feel like stigma is woven into some of the lessons that are in the key population section. But yeah, so then I broke so I have 72 students. So I broke them down into pretty big groups. There were groups of 7 or 8. And then it was 2 groups per topic. That's what I did. And then their goal with that, whatever topic they chose, was they had to design education material either for providers or for patients. And so while you had 2 groups in the same topic, you had different education material that came out of it. And then at the symposium, I had them set up in an auditorium, and I had the community members that attended just walked around and discussed, the student work with the students. And what was really powerful about this was some of the first time the students had ever made education material, or if they had, like, particularly with HIV. And then the people that were walking around were experts in the field or had lived experience. So it was really great and interesting conversations where the students were very humble and knew that they didn't, have that much to offer, just the little that they learned. But then the community members were really impressed with what the students had done thus far. So this was great. I used some of the money to make materials. Like, I had posters up, so I had the 5 different topic areas spread around the auditorium, and then tables around based on the student work. And then this is some just examples of the student work. So they just really blew me away. You can see that I encouraged them to use the National HIV curriculum as a resource, but then they were allowed to use other trusted reference sites. You can see PrEP. Well, 2 groups had PrEP. Here's one that talked about for providers, and here's the other that made education material for patients. Or STIs, this was the patient facing patient education, and the one in the lower left corner was for providers. And then, of course, students made mistakes along the way, and I was very, very hands off with this because I wanted real live feedback from community members about was this education material appropriate? Did it miss the mark? This is just an example of the rubric I used to grade their assignments or their education material. So if you're interested, I can send you this. And then at every table, I had a student feedback form where I asked community members, and I had healthcare providers there as well. I asked them to give feedback to the students, whether that was just verbally at the table or they could fill out this form anonymously, strengths of the material, areas for improvement, and then how was that verbal interaction with the students? Did anybody say anything that maybe was stigmatizing, or were they really open and receptive? And then, so this is just, I'll let you read, these are some quotes that I had from, I did a pre-survey and a post-survey because my hope is to kind of write about this and show how this can be impactful. So the nice thing was people were really satisfied with the event. So with the 72 students, I had 136 people total that came. And so I think about, well, 63 answered this question, but 92% were very satisfied. So that's nice to see. And again, I got some qualitative, I asked people at the end of the survey, what was the most impactful thing about the symposium? So yeah, it was really nice to see that had positive impacts there. Again, just to show, I think, I haven't fully analyzed the data yet, but in my pre-event, like this one on the top left was asking about that kind of the idea of rapid start, that antiretroviral meds can decrease the risk of HIV transmission. And you see, like, we had more of a spread than after I had more who strongly agreed. And then, the U.S. Preventative Task Force, it's a grade A recommendation that everybody be screened 15 to 65 for HIV. So I asked, like, should they? And you had more of a spread compared to after the event. I had more who strongly agreed. So, hopeful out of this, I can show some changes in attitudes happen and beliefs. And then I was asked, like, how did you engage the students in the community? How did you get them to be interested? And so just in general, I gave lots of class time to complete the lessons. I introduced the material. Actually, when I was guest lecturing in other courses back in January, I told them, hey, this is coming when I'm teaching you my course in March. And then day one in March, I gave them a heads up that this is due at the end of April. So they had over, 6 to 7 weeks to be completing the lessons. I integrated the NHC into my own teaching to make it just, pulling figures from there and just make it more relatable. And then I tried to minimize other assignments through the course. And I was very verbal about that, to just acknowledge aloud, like, I'm honoring that I'm asking a lot with you doing these assignments, and but I'm giving you the space to do them. And then for community engagement, it helped being connected to local HIV organizations, using that my county organization helped. And then those panelists, what's great about the panelists is they're all connected to HIV care in some way, and often they served in other organizations in the community, so they got the word out as well. So it was really expensive materials. It was actually like $1,500 just to print things. I printed all the student education material for the tables, and then $200 kind of like little fees, some Amazon orders. One student group wanted condoms for their table, so put all that in there. And then I paid my guest lecturers $750. It was quite a lot, but they were from out of town, and so had to get a hotel stay and drive. They're from South Texas, so that's why I paid them so much there. And then my panelists who were local, I gave $100 per panelist. And then the grant does not cover food, so my department paid for food at the symposium. And then some challenges I faced. I did this all pretty much by myself, and that was a mistake. I learned the hard way. I was in over my head a lot. I didn't mean to be a lone wolf, but I would say if you want to do something like this, get a team of people around you, or at least like 2 others to help. I finally used my admin in my department towards the last week, and should use them earlier. And then I'm not the best budgeter, so I really had to sit down with somebody to help me figure out budgeting. And then my sustainability plan, I plan to do something like this in 2025, a symposium, but probably on a smaller scale, maybe keep it in class. I still want to use guest speakers. Like, lived experiences was really powerful for the students, so I want to keep that. Also, continuing use of the National HIV curriculum, and maybe even challenging the students to keep creating education material. I'm kind of still sitting on that one. And my last thing here is maybe some surprising or not surprising findings. I was actually surprised, just full transparency, that students liked the curriculum. I found it, it's just a lot of reading. So when they gave me feedback that they enjoyed it, I was like, oh, okay, great. That was a surprise to me. They really liked working with the curriculum. So creating education material, actually, I didn't hear anybody grumble about that. They all, and even I just got my course eval, and nobody was negative about the assignment I had them do. They really liked the symposium. And then it was really cool. The community wanted to come. Like, even I got media coverage that I didn't even seek out, just because people find this, it's powerful. We're doing a lot to end the epidemic, and just in the nation as a whole. So, I mean, the community wanted to be involved. So that was really neat to see. And then also people were really surprised that, hey, this could actually work, targeting people at the student level before they go out into the workforce, which isn't surprising to me, but I think it's because I work in this world. So it was impactful for community members to see that this is a way that we could help the HIV workforce and change attitudes and opinions. So that's me. If you have any questions or want to chat, and otherwise, that is all.